So, for our final explainer on India's new health claims infrastructure, we're going to look ahead. We've spent a lot of time on the nuts and bolts. Now let's talk about how all those pieces come together to completely change the game for health insurance claims. So, here's how we're going to break it all down. We'll start with the problem that everyone knows all too well, the friction in today's system. Then, we'll walk through the new digital workflow that's designed to fix it. After that, we'll get into the real-world impact for hospitals and insurers, talk about how to get ready for this shift, and finally, look at what it all means for the bigger picture of healthcare in India. You know, if you've worked in health insurance or a hospital in India, you don't need me to tell you about the headaches in claims processing. It's a shared pain, really. The whole system has been built on this foundation of, well, friction. Let's just quickly get on the same page about what that means. For hospitals, it's this constant struggle. Payment cycles that drag on forever, huge administrative burdens, and just this uncertainty about when or if you're going to get paid. And on the other side, insurers are just buried under a mountain of inconsistent documents from thousands of different providers, which turns every single claim into this slow, manual, painstaking process. But here's the thing. These aren't just isolated problems. They all feed into each other, creating the state of system-wide friction. And that friction is what slows everything down, it's what drives up costs, and it ends up affecting everyone, from the finance team at the hospital to the patient who's just anxiously waiting for their claim to get settled. And this is exactly what is about to change. The entire ecosystem is making a huge shift, moving away from all these tangled, fragmented processes and toward a new model. One that's built on structured, predictable digital workflows. We're basically replacing all that chaos with a common digital language that everyone can finally speak. Okay, so what does this new world actually look like day to day? Let's dive into the new digital workflow and see how it builds a much smarter, much more efficient claims lifecycle. At its core, the new model is actually pretty simple. Instead of emails, phone calls, and countless portals, providers and payers will exchange all their claims information through one single, secure digital gateway. You can think of it like a standardized digital highway that connects absolutely everyone. And this highway has four main stages. First up, identity. Everyone on the network has a trusted digital identity, which ensures that only verified, legitimate players can participate. Second, eligibility. Now, this is a game changer. Hospitals can digitally check a patient's insurance status before treatment even begins, which will massively cut down on rejections. Third, submission. All claims get submitted in a standard structured format called FHIR, which is just the universal language for health data. And finally, number 4, settlement. Payments are digital, and automated notifications give everyone crystal clear visibility into every transaction. So a new workflow is great, but what's the real impact here? What does this actually do for the payers and providers on the ground? Well, the benefits are pretty huge, and they kick in almost right away. Because the data is standardized and machine-readable, claims can be processed in a fraction of the time. This, of course, slashes administrative costs for everybody. The clear digital trails mean total transparency and easier audits, which in turn helps rebuild trust between hospitals and insurers. And, the most important thing? All of this adds up to a much faster, much less stressful experience for the patient. Now, adopting this new digital plumbing, well, it's not as simple as just plugging in some new software. It really requires a strategic shift inside an organization. So how can hospitals and insurers start preparing for this change right now? First and foremost, you've got to align your internal workflows. The front desk that's handling eligibility checks, the clinical teams creating the documents, and the billing department sending the claims, they can't work in their own little bubbles anymore. All these teams need to be connected by one seamless digital process that reflects the new way of working. Second, of course, is the technology. And we're not just talking about having a fast internet connection. This is about building the core capabilities for secure API integrations, for managing security tokens properly, and making sure your systems can speak that new language of claims, the standardized FHIR data format. And third, and this might be the biggest opportunity in the long run, is building a real data strategy. You see, for the first time ever, the entire industry is going to have access to clean, structured, standardized claims data. That is an absolute goldmine. It can power incredible analytics, build smarter fraud detection, and even help design better insurance products that are tailored to what people actually need. All right, let's zoom out one last time. When you put all of these pieces together, you start to see that this isn't just some small upgrade. This is a fundamental rewiring of the very plumbing of India's health insurance system. This right here is the heart of the transformation. We are moving from manual, person-to-person coordination to shared digital infrastructure, from opaque, confusing processes to total transparency, and from a complete mess of different formats to a single, common language that everybody understands. Ultimately, what this whole series has been about is this one simple, powerful idea: moving the entire health claims ecosystem from a state of constant, grinding friction to one of seamless, predictable flow. That's the end game. And that is exactly where we at CaladriusHealth.ai are putting all our focus. We're building the compliant, production-ready platforms that help organizations make this transition smoothly, connecting hospitals and insurers to this new national infrastructure, and helping them make that crucial shift from friction to flow. And that brings us to the end of our series. The foundation for a complete transformation is now being put in place. So we'll leave you with one final thought to consider. As claims processing becomes truly scalable, totally transparent, and fully automated, how will this new reality reshape the entire future of health insurance in India? Thank you so much for joining us.